also, and I'm the Executive Secretary, Zamfara State Primary Health Care Board. We all know primary health care started as a unit in the Ministry of Health, but considering the relevance and importance and also the transformation of healthcare system of the Ministry of Health in collaboration with the National Primary Health Care, there was a policy that all primary health care services should be under the State Primary Health Care Board. So it was transformed from a unit to a department, from a department to now a board of its own. So this is a great transformation to increase the services and the quality of the services that are being given to the entire populace of the states and the country as a large. We all know primary health care form the bedrock of health care delivery services, because it's the first point of contact in every community where people access healthcare delivery services. But they provide basic healthcare services like immunization, antenatal care, nutrition, health education, hygiene and sanitation, and also demand generation. So these are the basic services that are being provided in primary health care. And so we have a great role of referral issues or cases that are beyond the capacity in terms of knowledge capacity or equipment or severity of illness. We refer them to secondary facilities. Those are mainly our general hospitals, where services are being offered at that level. And at that level, if for any of the reasons they felt they should require referral, they can also refer to tertiary facilities. So this is the category and the hierarchy in which we work in health industries. The month under review have conducted a lot of activities. For example, we did the outbreak response. In outbreak response, usually we have a national program where we conduct national immunization plus this. In that national immunization plus this is meant to reinforce the achievements of Nigeria as a country to achieve certification of eradication of polio. So with that, we conduct a campaign using a vaccine that we call NOPV, that is novel oral polio virus, that we conduct a campaign that covers the entire 14 local government. In this, you find out that we give the oral polio vaccine to children less than 5 years of birth. We put drops of that NOPV into their mouths so as to maintain our present status of polio-free Nigeria. In addition to that, we are into distribution of health equipment to all the facilities in the state. That is with support of UNICEF. And you find out that sometimes the facilities within our reach, within our communities, we distribute to them, while facilities that are hard to reach, we also move. We ensure that if it means crossing rivers or using other means of transport like camels, motorcycles, even if it means taking them on somebody's on our heads, we ensure that those equipments, commodities reach all the hard to reach areas of our community, where our population, where our teeming populace also live. So apart from that, we conduct issues that are relating to policy. You see, there is a emergency, state early newborn action plan, which is a document that was launched on behalf of the state. That document critically analyzes uh, the bottlenecks or the causes of neonatal death in the state, and they provide solutions where those bottlenecks can be addressed. So that is a working document and an advocacy tool at the same time that we are going to use. So it was launched with support of the UNICEF. It was launched by the acting commissioner of health, who is our permanent secretary in Ministry of Health. We also receive the COVID-19 vaccine, that's Moderna, and we also receive our second tranche of AstraZeneca. So presently we are out conducting the COVID-19 vaccination in the entire state, which is a very laudable activity. It's going on smoothly with the support of my Director Disease Control, the PM Program Manager for SERIC, and all the entire staff of the state and LGA. They are all working assiduously to make sure that we achieve a very successful activity. We also, in the month under review, uh, conduct what we call waste management. You see, whenever we conduct a campaign, especially of, let's say, COVID-19 or other campaigns that involves injectables, we have empty vials that we retrieve, and also we have safety boxes where the syringes are being dropped in. So it's our responsibility to make sure that those vials, empty vials that we receive, we dispose them properly. There's a standard way of disposing them, which we call burn and bury. We find that we have to boil them to make sure that we disinfect them, and then dig a hole and bury them using concrete. This is to ensure that people do not have access to the empty bottles that they use in their day-to-day activities, maybe selling of perfume or any other thing which is not meant for that in the first place. There is what we call clinical mentoring. This is a new concept. You see, because we realize that the rate at which we carry our staff to come and conduct training. You see, if you have a training that will take like 5 days or 10 days, it's not wise you take everybody from his facility, move him down to a state capital, or sometimes take them out of the state to train them on issues. So what we came with now is known as clinical mentoring. In this clinical mentoring right now we are piloting. What we did was to select some retired personnel of high integrity and skills. We engage them to go to selected facilities where they are going to work together with our existing staff. So in this, they are going to be training them as they are working. They are seeing the patients together, and then they are transferring their own skills to this staff. And that is also being supported by the UNICEF. We have trained we have had a sort of planning meeting where we agreed on the terms and conditions that are going to be applied, and we also agreed that there's going to be a monthly review meeting where we are going to assess the impact of what we have give them as an assignment. In addition, also we celebrated the World Breastfeeding Day. You know, at the first week of August of every year, there is a whole week long activity that we used to conduct. This is to ensure that the issue of exclusive breastfeeding becomes on limelight. We want to see that we create awareness where people appreciate the importance of exclusive breastfeeding, because without exclusive breastfeeding, all some of these diseases like diarrhea and vomiting, wasting as a result of malnutrition, cannot be treated without, cannot be prevented rather, without the use of exclusive breastfeeding. So we have used our religious leaders, we have used our traditional leaders, we leverage on our CSOs to make sure that we reach all the nook and crannies of the state to see that activities of awareness creation on the importance of exclusive breastfeeding, childbirth spacing, immunization, nutrition, and all other services that can improve the quality of healthcare among our populace are being conducted. So in brief, we also have our second dose. We all know that initially we were given IPV. IPV means inactivated polio vaccine that is being given at 14th week of life to a baby. So the policy of the country now introduced a second dose, which the second dose is going to come much earlier than 14 weeks. We are giving it at 6 weeks. So this has been successfully introduced in the states. Right now, all our facilities are given 2 doses of IPV. First dose at 6 weeks of life, second dose at 14 weeks of life. This is to ensure that we strengthen the eradication of polio virus in our state and the country and the world at large. So this is the summary of the activities that we are conducting. In addition, we also, as a country, battle with the cholera epidemics, which we know we had reported cases of gastroenteritis in the states, which we are very grateful to our staff and partners, and also all our colleagues at the state and local government level, where we work hand in hand to ensure that we are able to bring the issue to a start. We engage a lot of multi-sectoral collaboration. We had to work with Ruasan, with SERA, that's Zamfara State's environmental management. We had to work with Ministry of Humanitarian. We have to work with all other partners to ensure that we achieve to nip this disease in the states. So all these activities, if you look at it, you find that they wouldn't have been possible without the absolute support that we are receiving from His Excellency, the Executive Governor of Zamfara State, Dr. Muhammad Bello Matawali Shetziman Dola Usmania. He gave us the enabling environment to ensure that we are able to deliver this. We had all the support in terms of finances, workforce, equipment. This is why the partners, especially UNICEF, are with us to make sure that they complement in all the effort that the state government is doing. We are really, really appreciative of the work of UNICEF in Zamfara State. We also appreciate CDC Center for Disease Control. They support us. We appreciate new incentives. New incentives are doing a wonderful job in Zamfara State by ensuring our children are being fully immunized. We also appreciate the support of partners like WHO, partners like Red Cross, partners like Rotary International. They are all in the state. We are working harmoniously and they are giving their own part of contribution. I will not conclude this without extending our profound gratitude to the Emirate Council, Zamfara State Emirate Council, under the leadership of our father, His Royal Highness, the Emir of Ankara, and all the emirs in the state. We are really appreciating and enjoying your fatherly support and advice in the conduct of our activities. We are also very grateful to our Ulama, State Council of Ulama, where we use their medium to pass our information to our populace. We are also grateful to other commissioners that support our activities, like the Commissioner for Information, Commissioner Ministry for Local Government, Commissioner Religious Affairs, and of course the Commissioner of Health, who is giving us all the leadership and support that we want to deliver this activity. And I want to use this opportunity to thank all my staff, from the directors, the program officers at state and local government level. We thank you very much. I also want to appreciate the National Primary Health Care. National Primary Health Care is always there, giving us the technical support to conduct our activities.